Okay. Now,
Hello and welcome to my pediatric dental practice. Today I will try to help improve your ability to breastfeed your infant and at the same time make breastfeeding a pleasurable experience for you.
all the directions. On this side are all the questions that you're going to ask me.
Okay.
Now, what you're going to need to do, these are the exercises. Okay, you're going to do stretching in the lip 2 to 3 times a day.
Okay.
And you're going to massage in the lip every time you hit the front of it. Tearing it apart.
Okay.
And they'll want to go back together.
Okay.
You see your hand. When you stretch, you need to use at least this much force.
Okay.
This won't work.
Okay.
If you don't questions, the same questions that I asked when you got here.
Well, I think as soon as I first started breastfeeding Tegan, as soon as she was born, I felt extreme pain when I was breastfeeding. My nipple would be crushed, and there wasn't a sufficient latch at all. At the hospital I delivered at, they suggested at first using a nipple shield to help because they felt that there was a posterior tongue tie, and they suggested contacting you, Dr. Kotlow, for a revision to correct the tongue tie.
How far away are you from here?
We're from just outside of Rochester, New York, so about almost 4 hours away.
So you drive just about any place to take care of your baby,
Absolutely,
right?
absolutely, I would. Definitely did my research and was very impressed, and wanted to get someone who was the best. So immediately after the surgery, she came out. She was very calm. We tried to breastfeed and it went really well. Definitely not the pain that I was having before, and she latched on immediately.
What were some of the symptoms you had before we did the surgery?
Her latch was very shallow and it was very painful. She would nurse for extended periods of time, at least an hour at a time, and often. So I wanted to look for ways to improve the breastfeeding experience.